Right, good morning Queensland, and good morning to all of our Facebook followers as well. So today we have 0 new locally acquired cases, which is fantastic news, but of course we'll be monitoring everything that's happening in Goondiwindi over the next few days just to see how that goes. We have 2 new overseas acquired cases, but they're in hotel quarantine, so no problems there. We've had 11,850 tests in the past 24 hours. That's great to see Queenslanders coming out and getting tested, but we've had 200 people tested at our truck stops along the border. But very good news, we've had 245 people in Goondiwindi come forward to get tested at the hospital, so that's great numbers out there. So now we have in Queensland 78.81% of Queenslanders have had at least 1 dose and 65.81% are fully vaccinated. But of course we want to see those vaccination rates continue. So overnight, Moree was removed from our border bubble. There are 33 cases in Moree and there could be even more announced today. So what we do know is that a large proportion of people who are being tested positive are unvaccinated, so that's a concern. And that's in addition to the 3 cases that were reported in Queensland yesterday. So as you noticed, last night we tightened the restrictions of people being allowed to cross the border, and those restrictions will be tightened even further today for essential purposes. So what I'd like to do is I've put a call in to Lawrence Springborg. I've asked my Chief of Staff to also try and contact him whilst I'm doing this press conference. We will try and get supplies to those communities in New South Wales rather than them having to cross to get supplies into Queensland. We'd like to put this in place for the next 7 days. It's really important to make sure that we ensure the safety of those townships across our Queensland border. So I think people will understand that, and it's the right thing to do at this particular point in time. Okay, so they'll be in place for the next 7 days. Now also for the residents in Goondiwindi, and the Acting Chief Health Officer, Dr Aiken, will talk about this in a moment, that over the weekend we will be putting in restrictions for aged care and hospitals. So there'll be no visitors just for the weekend, and there'll be some additional PPE requirements for hospital staff, but I'll let Doctor talk about that. Okay, so that's fantastic news. Now this weekend is of course Queenslanders' opportunity to come out and get vaccinated. So there'll be 25 Bunnings pop-up clinics will operate this weekend. So please look at the website and social media and media outlets as to where you can go to your Bunnings to get vaccinated. And of course nearly 8,000 were vaccinated at our last Bunnings weekend, so we want to try and do that again as well. So if you have not been vaccinated, you need to come. Now what's going to happen is when the borders open, we will be seeing hundreds of cases, and what we're seeing in Goondiwindi is a prime example of a highly vaccinated community and the virus hunting you down if you are unvaccinated. As I said, there's this window of opportunity, and it is really important that Queenslanders come forward and get vaccinated. The sooner we can reach those threshold targets, the sooner loved ones will be reunited with family and friends. I know how important this is for families across Queensland, so please don't hesitate, come forward and get vaccinated. Now, National Cabinet is also on today, so I look forward to those discussions. I don't want to preempt discussions there, but some really important issues, of course, will be raised. That is the schedule plan for the booster shots. So for those people who have already had their 2 doses, it will be coming up time to get a booster shot after 6 months. We'll be looking at that plan. Of course, too, I'll be raising the issue that in the US now there have been approval for vaccines for children from 5 to 12. I know that's with ATAGI at the moment, so we really want to see how that goes in the US and how that can be implemented here in Australia. The more people that are vaccinated, the better our life will be. And the other issue, of course, which is really important, is the vaccination of our First Nations people. So, of course, the Commonwealth has put that on the agenda. They have been taking primary responsibility of that, and of course the states will be doing everything we can to assist as well. But bottom line, key is vaccination. Vaccination is the passport for everyone's freedom, not just in Queensland but around the country. So I'll hand over to our Acting Chief Health Officer. Thanks.
Thank you. And as the Premier said, only 2 new cases overnight, which is absolutely amazing news, and we're cautiously optimistic, but it's a long way to go, that there were no locally acquired cases in Goondiwindi last night or over the last 24 hours. The 2 new cases we have are both overseas acquired and in hotel quarantine. One of those has travelled from the Ukraine via Turkey and Doha and is day 5, and the other case is day 1 and has travelled via Doha. They're potentially infectious in flight, and we'll go through the normal process for those people. The other part with Goondiwindi, it's really good news, no local cases, and this is a highly vaccinated community. So there are no restrictions being put in place at this stage in the Goondiwindi community, but we are making sure we're protecting the most vulnerable members of that community and restricting visitor access to aged care facilities, hospitals and other vulnerable groups. And we'll also make sure our hospital staff are protected by making sure that the appropriate PPE for the risk environment is there to make sure they are all protected. The really big thing is that we continue to inch closer to 80% single-dose vaccination. Over 78, getting so close to 80, I would love to stand here next week and be able to say that we've reached 80% single-dose vaccination, and would ask all Queenslanders to get that done as soon as we can, get vaccinated, and to be able to stand here on Monday even and say we've reached that figure would be absolutely amazing. So please get vaccinated.
So with all of the opportunities available this weekend, going to your community pharmacy, booking in with a GP, going to one of our vaccination hubs or going to a Bunnings, there is no excuse not to get vaccinated this weekend. I do want to remind people who are due for their second dose to not delay getting that second dose. It is just as important that we have people coming out and getting fully vaccinated, as well as people coming out and getting that first dose, so that we can hit that 70% double dose and that 80% double dose and beyond as quickly as possible. So don't delay. If you are due for your second jab, if you got your first one at Bunnings, then come back and get your second one at Bunnings and get vaccinated as quickly as possible. I do want to give a shout out to the amazing vaccination teams travelling this vast state in our remote communities. Having spent yesterday in Mossman Gorge, I'm still to get final figures. It was around 40 people came out and got vaccinated in the gorge itself, and over 30 of those are first doses, but they were expecting to go from about 55% first doses to over 70% yesterday. So well done. And what was so incredible is these teams are not just knocking on doors anymore, they're actually carrying eskies and vaccinating at the door. They're seeing how many people are in that household and they're vaccinating everyone who's eligible in that home while they knock on that door. And that's what we have to do now. We have to reach in and try to vaccinate people in their communities, at our Bunnings, at our schools, at every area that's convenient for people to get vaccinated. But we can't delay. If you are thinking about it, if you've been planning it but you haven't done it yet, come out and get vaccinated. And what we are seeing in Goondiwindi is just another example of the risk that is right on our doorstep, that this virus is going to come into this state. It is going to spread through all of our communities, and the people who are going to be most impacted are those who are not vaccinated. So please come out and get vaccinated this weekend.
Thank you. Just a quick reminder to everyone that we remain where we remain in our current restrictions, so we have had no changes yet against the roadmap. We of course have some additional measures in place in Goondiwindi, and I'll come back to that. So yesterday, 9,500 vehicles coming across our border. We still turned around 113, and we issued 4 pins at our borders for people still breaching it, as well as another 2 on-the-spot fines for people that had come in on a particular pass and then not abided by the conditions of that pass. Can I tell you that from a policing point of view, we're not going away. We can continue to focus on what the current restrictions are and make sure that our community abides by them. Queensland's in the state it is because our community has been so committed to working within those restrictions. We've had an enormous amount of input from our community and compliance against that. Now is not the time to relax. It's not over, and we need to make sure we get that right. Our planning is really well advanced for what we will do as the roadmap unfolds, and we're very happy where it's at, but there's still some more work to be done, but we'll be ready to go when that happens. With relation to Goondiwindi, very pleased with the Goondiwindi community. We've pushed additional police out there, primarily to make sure that our border crossings are well policed and that only those that should come across are coming across, but also additional resources into town to make sure that people are abiding by the current restrictions and no breaches whatsoever. So well done, Goondiwindi. We'll continue to support you. Thank you.
Can you explain the changes you talked about with those extra restrictions now of people coming across the border into Gundiwindi?
They're going to be, health is going to be narrowing the exemptions down quite considerably to keep that community safe. I just think it's an extra precaution to make sure, like there's a lot of people that come across for essential reasons for food and supplies and everything, but we're going to talk to the councils about how we can actually get the supplies to those communities rather than having to cross into Goondiwindi just over the next 7 days, just to protect the community. It's just an additional measure that we just want to put in place.
Will the unvaccinated people in those border zones be allowed to go to school, across the border to school?
School will be limited for the next 7 days. Yeah, I just think we have to do that just to protect the community, keep that extra level of reassurance just for the next 7 days. I understand more cases reported today in Moree, and it's a situation where those communities come across quite regularly, and I just think we need to just clamp down just a little bit more over the next 7 days just to ensure the protection of the townships across the border.
We're being told that unvaccinated people are being stopped from shopping in places like Kmart and Coles. Is Queensland going to follow New South Wales' lead on that and stop people who are unvaccinated going to venues like that?
In the future, or are you talking about now?
Now and in the future.
Well, we're actually clamping down on that with these narrower exemptions for those communities. I think that what we will see in the future across Australia may be, until the vaccination levels are consistent across the nation, you will see some measures that will put in that only vaccinated people will be able to go to certain venues. You're seeing that in New South Wales and Victoria at the moment. I don't want to preempt what's happening in Queensland, but you could see businesses do that. You could see large festivals, for example, saying to young people, you can only come here if you are vaccinated. So it's in everyone's interest to get vaccinated, and the biggest issue we have at the moment, I believe, is our 18 to 39-year-olds. A lot of our younger people are just probably thinking, oh, well, is there a need to get vaccinated? And there is a real need to get vaccinated. So if you're a young person, you're going to keep everybody safe. And think about it from your perspective too. If you have grandparents who may be in aged care, you know, really, it's up to you to get vaccinated so you can continue to see them, so they don't get the virus.
Those decisions will largely be left to the businesses and not the government.
At the moment, but we are looking at all options at the moment.
Given your concerns for that younger age group, what initiatives is the government rolling out to specifically target young people and their families?
We're looking at a specific social media campaign for young people.
Will the government be rolling out backstops at schooling?
I think that's something we're looking at. Yeah.
The AMAQ's report card is out today, and they've again described Queensland hospitals as being overwhelmed. One of the things that they've called for is a public health order to mandate vaccination for those healthcare workers who aren't employed by Queensland Health. I know this has been raised before. Any movement on whether or not...
In the private sector, yes. My understanding is that there are discussions. I know that Dr Young, before she took up her position as Governor, was actually starting conversations with private healthcare providers specifically, and the private hospital systems about them being vaccinated, being fully vaccinated. Yeah. And just in relation to your other question too, it's not an issue just for Queensland. There are issues across the nation with presentations to hospitals, and secondly, which is very, very clear, with COVID comes a surge that is we are going to see in our hospitals, and we are going to see that with our unvaccinated people. So this is a clear wake-up call to Queenslanders. If you are unvaccinated, you need to go and get vaccinated, or you could end up in hospital or in ICU. This is what's happening in other states, and it's what's happening in other countries.
There are reports today that the PM is taking a package to National Cabinet on healthcare funding. Have you, for states, have you heard anything about that? What's your understanding of what will be?
Look, I'm not going to comment any further on National Cabinet. I think everyone can appreciate that these are discussions that need to happen within National Cabinet. I expect it to be a long meeting. The papers were as thick as a Tolstoy novel, so there is going to be a very long meeting.
The federal government says on the modelling, there's been modelling sent to your office or sent to the government about what might happen with Queensland with international travel, when international borders reopen, and also Indigenous communities. Have you seen any of that modelling?
I'm not going to comment on National Cabinet papers.
Given those surges of the cases, though, how are these smaller hospitals going to cope? You know, with the air transfers yesterday.
Yeah, as we said, yeah, there are plans in place, and we will be. There will be. If a person is very sick, they will be transferred to a hospital that can take care of them. But the way to prevent that from happening is to get vaccinated.
Do you think a social media campaign is going to be enough to encourage these people in their early 20s to get vaccinated?
Well, it's a good start, and a lot of people are on social media.
Don't you think the government should be taking a more proactive approach, like in Indigenous communities, the government started going door to door? Do you think there should be more initiatives going to where young people are?
Look, I think we've been very clear about where we can let young people go to their GPs for a whole range of advice. They can go to their GPs, they can go to their pharmacies, and the bulk of Queenslanders are going to their GPs and their pharmacists to get the vaccine, and to Queensland health facilities.
But young people aren't doing that at the moment. The vaccination.
Well, we are seeing an increase. We are seeing an increase across the state.
When are we expected to hit 9%? Is there a date?
I don't have the date, no.
And do we have a date, though?
My understanding was it was sometime in January.
And given we're right on the edge of that 80% first dose, and most people in Queensland have had Pfizer or Moderna, do you think that we will hit that 80% before December 17th?
Well, our indications are that we should hit the 70% double dose around middle of November, which is what we were expecting, and then we are still on track for middle of December.
Do you
So
think it will be earlier?
I hope so. I really hope it is earlier, but that depends on people getting vaccinated and young people getting vaccinated.
Those people who are vaccinated late won't be fully protected, though. We're not
They won't be
going to
fully
able to
protected, but at
say
least they'll
what-
have at least one dose. Okay, so you know, I want Queenslanders to be as protected as possible, but having one dose is better than having 0 dose.
Is there any data on the Gold Coast about how far they are off getting their December 17?
Sorry?
Is there any data on the Gold Coast and how when are they expected to meet their targets around?
We've seen an increase in the Gold Coast. I had those. Sorry, I don't have those figures with me today. I think from memory it was around 77% first dose. They need to really lift their game. Like honestly, I am concerned that the Sunshine Coast has much higher vaccination levels than the Gold Coast, and the Gold Coast is really close to the border. And we're seeing what's happening at the moment in Gundawindi, and exactly the same could happen on the Gold Coast. So I'm urging all Gold Coast residents, and even if you are going to visit the Gold Coast for holidays, you should go and get vaccinated. It is really important because, like I said to you, this Delta hunts down people, hunts down the unvaccinated.
Is there any evidence, in the Gundy case, is there any evidence that there were border breaches involved?
Not to my understanding.
So those 3 people facing fines yesterday.
I'm not aware of that.
And how were so many people who are unvaccinated able to go to that funeral?
Well, most of them were from Moree. Most of the people who are in Moree.
What do you say to Queenslanders who are stuck over the border, who are sleeping in their cars or tents?
Not long to go.
Still 6 weeks though.
Yeah, well, I've got to keep Queenslanders safe. We put out the plan. Everyone's seen the plan.
Okay, thank you everyone.
Thank you.